The series has articles and essays which paints a very wide canvas of picture and provides both national as well as a continental perspective to the impact of COVID-19 pandemic. And it also has had like what effect it has had on the economy, to the society and technology. It also gives a wider picture and looks at the past, the present, and the future of the emerging research on public policy, particularly healthcare, geopolitics, society, and technology. And we also get a better picture or a grasp of what the world would look like post the COVID and what it entails for all of us. We are very privileged to have an eminent set of panelists today. I would like to introduce them. The first one is Ms. Nirupama Rao. She has served as the India's Foreign Secretary and has been India's ambassador to the United States, China, and Sri Lanka. We have Mr. Keshav Desiraju, who is the former Secretary, Ministry of Health and Family Welfare, Government of India. He also continues to remain engaged with issues of public health, particularly mental illness and mental health, primary health care and community health, and serves on the board of several non-profit organizations in this sector. We also have Ms. Kiran Mazumdar-Shaw. She's an Indian entrepreneur. She's the chairperson and managing director of Biocon Limited, which is a biotechnology company based in Bengaluru now, and was also formerly the chairperson of the Indian Institute of Management at Bangalore. She will join us shortly as she had a commitment which had come up at a short notice. And talking to them would be Maya Mirchandani, my colleague and co-editor to the series. I really look forward to an engaging discussion this evening. Before I hand it over to Maya, I have a few housekeeping announcements. To all the participants who are there, I would just request them to type in their questions in the chat window, and we will try to take up as many questions as possible when we have the Q&A session after the discussion. And I would also request all the panelists, except the three main panelists, to keep their audio and video off and audio on mute, so that at the time of the discussion is happening. And also we would like to tell you that this session is going to be live streamed, and we are also recording this webinar. So over to Maya.
Well, thanks a lot, Shoba. And just to add on to that, to the panelists who are joining, I also see Ambassador Vijay Gokhale, Nirupama Rao, and Mr. Gokhale have both served in Beijing with lots to talk about today. Thank you all for joining us. I will ask some of you all to make interventions as well once I'm done with some of these opening remarks. But Ambassador Rao, if I can actually start with you. Two things. One is, of course, that it's almost like a pincer-like vice grip that China seems to have, well, the world and certainly India in on two fronts. One is COVID and one is what's happening in terms of national security. But given that this conversation is really about the coronavirus pandemic, I'd like to ask you from the perspective of diplomacy, public health and community health is now front and center of national security. It's front and center of global politics. How do you think this is going to shape conversations going forward, irrespective of what's happening on the borders? Just unmute your microphone, Nirupama. Sorry.
Thank you. Thank you, Maya. I presume your question is, how is this going to affect our conversation with China? Or do you mean, Well,
how is it going to affect our conversation with China? Certainly. But I think I'd like you to also give us a broad global picture of how does it impact the world's conversations with China?
Well, all across the world, as we've seen, even before the advent of the coronavirus, this whole question of how the world is to deal with China. Secondly, how we are to deal with the disillusionment about globalization, how we are to deal with the rise of nationalism and an attempt to build these walls around us. And in the midst of all this, given all these challenges, the coronavirus made its appearance too. Now, will the world be the same after the pandemic is over? And it's going to take a while before it's over. So the priorities before us, and especially for nations such as ours, with a rising number of coronavirus cases and the challenge that our public health infrastructure faces under these very, very challenging circumstances, is, I believe, to first focus on how we have to deal internally with the threat of this, as somebody called it, this disease of mass destruction. And when it comes to diplomacy, I was just thinking of the focus that this current situation has brought on, I'm talking of, consular diplomacy. Now you look at the amount of evacuations that have been needed, the movement of people across borders, bringing citizens home, and what are the challenges that consular diplomacy faces under these circumstances. Now, today's diplomacy has to work in a very different, non-sequestered world, and I'm not just talking about the impact of globalization. Today's diplomacy has to work with investment funds, with NGOs, with charitable organizations. The numbers of actors in this situation has grown exponentially. So I think what the pandemic has also brought home to us is the need for us to rework our approaches to these traditional fields. That's one point I needed to make. Now, coming to China, of course, it's our neighbor, and we have huge problems on the border, as we've seen from Monday night's events in Galwan. But even before that, I think the questions had grown within the debate in this country, whether the modus vivendi that we had crafted as far as our relationship with China over the last 3 decades was really going to last. Was it fraying at the edges? What were we going to do about the imbalance of trade? What were we going to do about the increasing Chinese muscularity and assertiveness? So all these questions were very much front and center even before the pandemic hit us. Of course, China has tried to make use of, after its early flat-footedness about dealing with the cases in Wuhan, it's tried to come out of this and give the impression that it is victorious, that it has dealt with the situation within the country, within China, the pandemic situation within China effectively, and that it's ready now to be this benevolent hegemon as far as the world is concerned, that it's going to be able to provide health diplomacy, which is another new field that has come up in the discourse. Now, even India, of course, has been dealing with China on that front. But where is all this going? What does the pandemic teach us? Even as we try to close borders and even as we try to build walls, the virus, of course, has defied all those barriers and come home to us in a very, very disastrous manner. So post-pandemic, what is the future of the multilateral institutions that countries like the United States, for instance, have raised so many questions about under the leadership of President Trump? You've seen the difficulties not only with the WTO, which existed before the pandemic, but now with the WHO. It's been drawn into the geopolitics and the geosocial narrative today that we face. And if we are going to weaken organizations like the WHO, which has been at the forefront of delivering disease prevention and control to the world, especially the developing countries, how are we going to deal with the post-pandemic world in which multilateral institutions like the WHO have lost their saliency because of power politics and because of the geopolitics of what we see going on around us? Now, countries like India, who have traditionally taken the middle path in everything that they have done, what is the leadership role that they can assume in this scenario? That's another question I think we need to pose to ourselves. So these are some of the points that I wanted to bring up in response to your question, Maya.
Right, thanks a lot, Nirupama. A lot of food for thought, and I'll come back to some of the points you raised in just a minute. But before we move on to include some of the other authors we've got joining us, Keshav Desiraju, former health secretary, I want to ask you, did you ever think that you would see a stage where India's public health system was going to be the focus of such a kind of government attention? Did it have to come to a crisis like this for all eyes to be on this. And just as a sort of corollary to that, the fact is that, we've seen the biggest countries, the most developed countries in the world, whether it's the United States or France or the UK, Italy, their health systems collapse and crumble under the weight of the coronavirus pandemic. Would we realistically have been any different than we are today?
Thank you, Maya. And well, did I expect this sort of attention to the public health sector? No. But did it have to come through a crisis? Probably yes. This is normally, we only stand up and look at something when it hits us in the face. I mean, many of us here will remember Surat and the plague, which was the early 1990s. Nobody was talking about water and sanitation in any serious way till that happened. And so it probably in our resource poor setup, it takes a crisis of this magnitude to focus attention. Now, what we should hope and pray for is that that attention is taken seriously, and we do see post-COVID, we see more substantial, more meaningful financial and other interventions in the public health space. It doesn't seem, I mean, people are talking about it, but we won't know till we are past the crisis. And I will say that at this point of time, our attention has to be focused on the immediate crisis at hand. There are still people, I mean, I live in Chennai. Every day, the number of new cases being identified is increasing. So there are several Delhi, Mumbai, Chennai, Ahmedabad have to focus right now on how most effectively, most quickly we can identify, isolate, and treat the persons who have been infected. How do we address the populations most at risk, the elderly, the diabetics, hypertensive? It has to be said that the first lockdown, 25th March to end April, whatever, we did not really use that time in proper test identification of populations most at risk and in, taking steps towards that. And then there was the whole migrant situation at that time. So Chennai today has gone into total lockdown till the end of the month. So we're hoping that there will be some of these focused attention. Because right now, this has to be the priority.
Just as a very quick follow-up to that, do you think that because there was such an unforeseen domestic migrant crisis that we saw unfold at the start of the lockdown, that it sort of took attention away, administrative attention away from the task at hand, which was to be able to at least temporarily ramp up infrastructure? The two kind of ended up being in conflict with each other?
You're absolutely correct. But the question we must ask is, why was it unforeseen? I mean, this is the business of government. If more people were involved in taking these decisions, it would not have been unforeseen and leading to complete chaos, which all of us saw happening. But you're right. The attention got focused to handling the question of the people who were on the move. And it took, I mean, obviously government needed to respond, state governments needed to take action, and that took time, the courts got involved. But you're right, it did take attention away from testing and treatment.
Okay, Nirupama, let me just come back to you as well, because, you mentioned that point about how the WHO has now become this sort of new battleground of global diplomacy. And you talked about the fact that there has been, even before the pandemic, a sort of tension between China and its, superpower status or aspirational superpower status with the rest of the world. And a lot of that hinges primarily on the kind of political structures also that are in place and the economic heft that China carries. Do you think that China's economic heft will still see it through this crisis? Unmute.
The problem with Zoom. So thank you for reminding me. I'm technologically challenged, I'm afraid. Yes, to answer your question, will China's economic heft, well, one has to concede that it's considerable economic heft, but that is also not to confirm that all is well with China. And internally, of course, I was reading somewhere that the debt to GDP ratio for China, it's 310% of China's GDP, China's debt within the country. So they've been spending their way through all these infrastructure projects and making China big and rich and powerful and influential. And of course, the BRI has also spent so much commitment for them abroad and all the loans they've made and that kind of commitments that they have been tied to. So will they emerge as strong as they were from the pandemic? One really cannot say that the answer is completely and unequivocal yes. But the fact is that they've had a head start on many of us as far as the coming out of the effects of the coronavirus are concerned. The first 2 months of the year, the situation was very bad in China. But now with much of the lockdowns being lifted, we've had some news from Beijing that some cases have been found there. But, manufacturing units have opened up and, economic activity has been restarted within China. So they have a certain advantage. And because of this political system that they have, the authoritarian Communist Party driven system that they have, they've been able to, I'm not saying that that's a plus point that others should be looking at, but the facts are facts within China that has helped them to do the lockdown, come out of it, make sure that things are welded together once again. So to that extent, their economic heft is still a formidable force.
Okay. A formidable force. Mr. Gokhale, I know that I had told you that I would let you just be a participant, but I can't resist kind of bringing you into the conversation. So I just like to ask you, if you're listening in, this idea that China's, in spite of its own internal economic situation, the sort of perception and stature in the world is still that of a country that controls a lot of the global supply chain and things like that. So, we're seeing this move globally, whether it's in the United States, whether it's in India, this idea that, as Ambassador Rao pointed out, that globalization is something that needs a relook at. We should be self-reliant. Our economies should be self-reliant. We've seen a kind of shutting down of the world, really. International travel has come to a standstill. We don't know what visa regimes will look like when we emerge from a crisis like this. What are your thoughts? I mean, I know that your essay was titled Reading the Tea Leaves in China, but I'd like you to just read the tea leaves for the rest of us as well, a little bit on stuff like this. And you can unmute your mic as well.
Yeah, thank you. Thank you, Maya. My own view in this matter is that I think we have to still see whether globalization will be impacted and in what manner. There are certain aspects of globalization which can't be reversed. For instance, requirement of resources and energy by countries will mean that there is movement of these across international borders. I also doubt very much whether we can completely give up the efficiency of the global supply chain system, because that was what China and now Vietnam and Bangladesh and hopefully we will leverage. Perhaps just in time might be replaced with some other philosophy, but I think that the global supply chains will remain. In any case, it is my view that we should not expect global supply chains to move out of China anytime soon, simply because you can't lift up a factory from one place and move it to another. Perhaps fresh investment might not come. That was already happening before COVID, because European and American companies felt that the playing field was no longer a level one for them. But China will remain an integral part of the international supply chain. And it is for us, of course, to plug ourselves into that system. I am of the firm belief that that cannot be done if we interpret self-reliance to be autarkism. We have to be part of the global free trade arrangements. We cannot blame others for our own inadequacies, whether in terms of our own competitiveness or in terms of not putting up non-trade barriers, which others put up to deter imports. But if we don't become part of the global supply chain, then how do our companies scale up from local to global? it's not just a one-way street. It is not foreign companies coming in to sell. It is hopefully our companies and our startups going from local to global. And that happens only when you're part of the supply chains. So that's my view, Maya.
Right. Okay. I'll just come back to Keshav as well. I think what Ambassador Gokhale has raised is a very important point, which is that, you know, for all the desire to want to kind of be self-reliant and develop your own infrastructure, manufacturing, things like that. I think there are realities that need to be factored in. I mean, when the outbreak began in Wuhan, for example, we saw the Chinese set up a prefabricated hospital entirely, I mean, virtually overnight. You know, that kind of capability is a long time in the making. And for countries like India or developing countries in the neighborhood or in parts of Africa, how realistic is it to kind of expect that we'll be able to get in a short amount of time? Because if that's what COVID is demanding, that kind of self-reliance, you know, we're a long way from that. And just, you know, as a quick sort of aside to that, one of the doctors I was speaking to in Delhi said, you know, he's an AIIMS graduate from 1980, and he said, essentially what we need is an AIIMS in every state capital, a Safdarjung in every district headquarters, and a Ram Manohar Lohia in every tehsil of the country. And even that won't really be enough. So when we talk about capability, where do we factor in a reality check?
Thank you, Maya. Maya, I don't see that sort of capability, putting up a 1,000-bed hospital in 7 days. And I don't think we should look at that as our objective or as our target. But what I believe is possible is if we focused and funded the upgradation of primary health centers to a respectable level. Now, this is possible. This is what the government says they are doing as part of Ayushman Bharat. Now, there's a lot of smoke and fire about Ayushman Bharat. I don't want to go there now, but part of that is developing what they call health and wellness centers. Health and wellness centers are supposed to be of a certain reasonably high standard, both in terms of the services available, the doctors, the nursing, the medicines, the diagnostic tools. It should really be a very, very respectable primary health center. That is something we can try for. It won't happen in a week, but if it was seriously done, I don't see why in the course of one financial year, we would not be able to get most of our primary health centers functioning at that level of efficiency. That is, I believe, in our system, we can try for. I don't think we should try for anything much quicker. And very quickly, you said, a colleague of yours had talked about an AIIMS in every. Now,
my doctor, actually.
Your doctor said this. Now, AIIMS Delhi is a wonderful institution, but let us also remember, all illnesses and all health conditions don't necessarily need an AIIMS level of treatment. AIIMS is supposed to be tertiary. 1956, when Amrit Kaur set up the AIIMS, two big responsibilities. One was to be a tertiary care institution. Two, it was to train medical faculty to teach in government medical colleges across the country. Unfortunately, the bulk of the 1960s and 1970s graduates of AIIMS went abroad. They are running the NHS in the UK, and they're doing all sorts of things in America and everywhere else. It didn't happen. So now, let us learn from that. If you do want to set up an AIIMS in every state capital now, there must be some system by which these AIIMS-trained graduates begin to teach in government medical colleges across the state where they are. Because without faculty, you're not going to have medical. We need government medical colleges, but without faculty, those are going to be non-functional again. None of this is short-term. All this is medium to long-term. But if we start now, maybe 8 to 10 years from now, we will be much better equipped to handle a pandemic of this nature.
Okay, on this, if I can bring in some of our other authors, I'd like to bring in Jaimal Anand, who is, he works with South Africa's Department of International Relations and Cooperation. Jaimal, if you can get a clear audio from here, the piece that you wrote in this edition that we've looked at is sort of a comparative also between the Ebola outbreak and how the world dealt with that, and the challenges of COVID. But, factoring in some of the conversation we've heard so far, both about public health as national security, as well as the challenges to globalization and, public health infrastructures, irrespective of how developed a country is. From the African perspective, when you look at Ebola and you look at COVID-19, just people who are joining us here, what do you think can be the lessons?
Thank you very much, Maya. I just want to start by congratulating India, though, on the accession to the United Nations Security Council for the next term. It was quite a resounding vote that you received also. And I think a lot of what we are discussing right now and the question that you raise rests in some of the principles that India has articulated and outlined for the Security Council term. The S's, the 5 S's, sort of reflect a little bit of what was written in that article as well. But being specific to the African context and how diseases like Ebola and now COVID, but in between, of course, we have other major issues from tuberculosis to malaria to, in South Africa, for example, diabetes. These are high-rated killers. And it seems as if a disease or a virus like COVID is opportunistically attacking people who already have those conditions as comorbidities and resulting in fatal outcomes. So I think that's the first point. In terms of the African context, we already have an underlying algorithm of virus transfer and movement across our borders, within our regions, and it's linked to many factors, ranging from inadequate public health facilities to the existing lifestyles and the security situation on the continent. But moving from that as well, there was a very interesting book around 2015 on disease diplomacy. And I think that's where this process of arriving at COVID, starting with MERS and SARS, and of course, in the African context, issues of Ebola, and we had Zika a few years ago in Latin America. None of what is happening under the COVID paradigm is new. The world has been going through this over and over again. What is, of course, new with COVID is our response. States throughout the world have been able to sacrifice their economies, including Africa. They've been able to push resources towards sectors that have been needing the resources but starved for them, public health being one, social security facilities. In South Africa, billions are being poured into social services, in assisting people who cannot survive financially. As you know, we have what they call 2 economies, and the large majority of South Africa remains in a state of dire poverty, very similar to India and many other Asian states as well. But on a more philosophical level, when we speak about the existentialist realities that we confront as Africa, as Asia, Latin America in particular, I don't want to go into the countries of the North and their health system. They have very different dynamics in many ways. But we are increasingly moving toward an ideational world, a world where the very existence of processes like engaging on serious issues through webinars, engaging on issues at fora that we never thought we'd be engaging on such serious matters with, our presidents having summits online. I think this is creating a whole new and a very interesting dynamic in terms of how ideas spread. And that is what we are now locking into. And what's interesting about this ideational process that's currently undergoing, strongly in the diplomatic groupings, but also prevalent among public health practitioners, medical scientists, etc., is this incredible and rapid flow of information globally. And maybe the flow of information through resources like the internet and other facilities that people are using sort of links into what Gokhale was just referring to as well, in terms of the supply chain, the global supply chain. This information flow, this information process, the flow of ideas, this level of cooperation in terms of best practice or whatever it is states are trying to achieve has really been enhanced. I don't think we've ever seen this level of flow of information technology globally as we've seen now. So yes, I think that's one element that we have to be very strong on, this ideational reality.
That's an interesting point that you've raised, and Ambassador Rao, if I can bring you back in on this, because you have, in a sense, these two conflicting and tense equations, so to speak. One, that there is this need to kind of move inwards, be self-reliant, question globalization. On the other hand, at a time like this, when Jamal calls it disease diplomacy, it's brought for everyone to clearly see the need for sort of collaborative and cooperative diplomacy as well, so that you have both these pulls and pressures tugging at each other at the same moment in time.
Absolutely. There are these two conflicting trends and pressures and dialectics in operation. But I think a common sense approach, a sensible approach for diplomats and public servants and policymakers everywhere should be towards solidarity and integration in these circumstances. Because what does disease diplomacy entail? It essentially means that we need to have collaboration in scientific research. We need to allow the experts to be able to determine the way forward in tackling the challenges we face. We need to take on board what the experts have to say when it comes to the formulation of public policy. We need to set aside, the differences, the political, the geopolitical, the competition between big countries at a time when this, as I said, is a disease of mass destruction that faces us. And there are millions and millions of impoverished, underprivileged, people who are unable to have access to the resources. We see that happening in our own region, within our own country. So all the more reason, I think, to stress the need for greater solidarity, even as we see these pulls and pressures to bring in the politicization of the everyday, as it were. We need to depoliticize the everyday, the humdrum, the normal,
Right. I think that's a very interesting framing of depoliticizing the everyday, because, while we're talking about our own internal dynamics, a global dynamic, this sort of politicization of the response to COVID, I think we were all watching New York City very closely to see how, that became the sort of global epicenter. It became the sort of battle stage for a fight between the Republicans and the Democrats, feeding into the election campaign, all kinds of things. Nikhila Natarajan has written a wonderful piece called, entitled "Doctors as Storytellers," and some of the even preliminary research, Nikhila, the preliminary findings of treatment and trials and things, they've all come through a network of New York City doctors who are communicating with each other on WhatsApp messages and just sharing stories. Tell us about how you actually, how they've survived, how the city has survived, and how there are learnings in that for everyone, because it's sort of coming out into the world in a new way of interaction.
Yeah, Maya, when the chronicles of this pandemic are written, it will be a contest finally between story and statistics. But for the moment, all we have is real-time research. That's all there is to COVID-19 literature, right? And doctors who are willing to get comfortable in this unusual space, and that's why I say willing, not everyone is. When they get willing to be comfortable in that space between hard evidence and chatter, and that's not their training, then they become our go-to resources in a tumultuous moment. And loosely structured communication is what we've written about in this chapter. And that's filling a vacuum left by the state. The state has chosen to leave that vacuum for whatever reason. And doctors and patients are sharing a history-making experience in that vacuum, because that's all there is we have. And for all the flack that social media platforms got after the 2016 elections here, they are kind of journeying back to their original promise. The same behavioral targeting that they do in this moment, they've all kind of banded together to show us what really matters. So it's helping communities organize to that extent. And has it been the story of New York as much as it has been of San Francisco? Oh, yes, totally. Why have the graphs differed? Well, because those who listen to the scientific advice and lockdown earlier, it's as simple as that, those curves got crushed. But where have we, the people, the commoners, got our information from? It is from that vacuum which has been filled by medical Twitter, really.
Right. Okay. And I can see on our screen that Kiran Shaw has finally joined us after her meeting. Welcome, Kiran. We've been talking about the impact of COVID on, global politics, on public healthcare, and we still have more questions for Keshav, which we'll come back to. Nikhila was telling us about doctors in New York who've been sort of loosely communicating with each other, and the chronicles of COVID will then, when they'll be written, she said, will be as much about the story as much as it is about statistics. And those statistics need to be arrested with the development of treatment, cure, vaccine, all of it. You've just emerged from a meeting. Tell us, how close is the world to any sort of treatment protocol? It is the one question on everybody's mind today.
Well, Maya, there are a number of things that need to be done to really cope with this pandemic. As you very rightly said, I think we do need to come out with a treatment, a reliable treatment that can actually give us a lot more comfort until the vaccine arrives. And I think we are beginning to understand the disease a lot better. And, every week you hear about some wonder treatment or some wonder drug. But I think what we really need to understand is that there is a disease continuum. And along each part of that continuum, something works quite well. And we also know that what is really scaring everyone is the mortality rate. Okay. And as long as we are able to bring down the mortality rate, I think you will start feeling a lot more reassured that, it's not so bad. We are, at least from a scientific world, from the pharmaceutical world, I feel that we are beginning to understand the disease a lot better. We are beginning to develop treatment regimens that are going to bring down death rates. I'm very, very confident of that. And as far as the vaccine is concerned, of course, these are making very rapid progress. And this is the first time in the world that we are seeing the regulatory agencies actually work very closely with the companies that are developing vaccines to see how fast it can get into the market. Now, the point is, I think even if the vaccine does, come into use before the end of the year, like it's being claimed, I think we have to also understand that this vaccine will really be like an emergency use vaccine. And so you will actually be giving it to sort of a select group of vulnerable people. And then the real, large, widespread use of the vaccine is only going to happen in 12 to 18 months. So I think you need to get real about how quickly the vaccine is going to be available at large scale across the world. And if you are willing to accept that you're not going to have, easy access to a vaccine for another 12 to 18 months, because it's not just about a vaccine being developed. It's then about the scaling up, the availability of the vaccine at large scale, etc., etc. There's also supply chains. There are also so many other aspects of the vaccine being available that it would be crazy to think that everyone will have access to a vaccine by the end of the year. So until then, I think you really need to develop good treatment regimens which don't scare people that, they're going to die.
I think that's a very important thing. I mean, that as we speak, I know that I have a friend whose father is using an oxygen concentrator, and he seems to have turned the corner with that over the last couple of days. So there are, ways that people are trying to cope as best as they can. Keshav, if I can just come back to you very quickly, there's a couple of questions. You made that point earlier, and some of our participants at the webinar are also raising this issue about, just boosting your primary healthcare centers. We saw that experiment in places like Delhi with the Mohalla clinics. What has happened to Delhi in the midst of the pandemic is another story and the subject of an entirely different webinar in itself. But so one thing is on the primary healthcare side, and I'd like you to also come in because I think Lakshmi is not here anymore. But on the issue of what we can learn as society, we're seeing in the United States, for example, people being told how they can hug each other in COVID times. The fact that intimate physical contact between people has virtually come to a standstill and is likely to stay that way for the long term. What you talked about working in mental health. So what kind of impact, even those who don't suffer from the virus per se will have to confront going forward? Unmute your microphone.
Is it better now?
Yes, we can hear you now.
Maya, very quickly, the many things in what you asked, and I would just like to touch on all of them. Without going into the Mohalla clinic example, I still believe that a respectable, well-functioning, well-resourced primary health level of treatment is essential. I mean, there may be aberrations, there may be mistakes, but I don't think we can do without that. Secondly, I think the other very important thing to remember is right now there are very large non-COVID consequences of what's been happening. For instance, we have a paper that Madhu Pai and Jacob Biggio published just today. Around the world, huge increase in additional deaths because of tuberculosis, malaria, HIV, increased maternal and child deaths, huge reductions in numbers of persons, number of babies who have had routine immunization, huge increase in unwanted pregnancies. And in all of these, India has a sizable share. Now, these are health crises that we are going to have to face in the months which come. People who have missed out on it right now in Chennai, where I live, for instance, if you have a non-COVID complaint, there is no place for you in a hospital. No one is going to look at you if you have a non-COVID complaint. So this is something, but these are all really issues that competent primary health level of treatment can tackle. Now, specifically within that, very quickly, if I can make another point, routine immunization has taken a very big beating. All babies need 9 shots within the first 12 months, and we have lost 3 months in this process. This is a very, very serious matter. And in India, 26 million babies born every year, more or less. That is 70,000 babies a day, more or less. And if they've lost out on essential immunization in the early months, we will know the impact of this later in the year. We must ensure the system, from right now, systems must be prepared to cope with possible mumps, measles, diphtheria outbreaks because babies have not been vaccinated. That is something to remember. And another very important thing we have to look at non-COVID is school education is complete washout. So one whole year has been lost.
Right.
Again, to use the same back of envelope figure, if 26 million are born every year between the ages of 6 and 14, it comes to about 200 million people. Now, if a child is going to a private school, there is some talk of online learning and all this sort of stuff. But for the very large number that go to government schools, corporation schools, this year has been lost. It's not just the year's schooling which has been lost, it is the midday meal that has been lost, which is not a supplementary sort of meal. It's probably, for many kids, the only decent meal they get in the course of the day. So these are very, very big policy issues that we need to be prepared for, and we need to be able to address.
Right. So I think that, that's a good point. There are so many other little points in the ladder that are getting sort of neglected or left by the wayside. Kiran, Shaw, a couple of questions. one that we have from one of our participants. What about lifestyle issues and social obligations that will change as a result of the pandemic that we're through? But I think more importantly for you, in terms of how Indian pharma is playing a role on the world stage, whether it's the vaccine trials, whether it is antibody testing, whether it is treatment protocols, where do you compare with what's going on with other global companies as well today? Unmute your microphone, Kiran.
Sorry.
Yeah, no problem.
I think India obviously is going to play a very important role in this pandemic and in future epidemics or pandemics, because we are the largest vaccine producer in the world by volume. And we also are low-cost manufacturers of drugs. And I think with the kind of population we have, I think we ought to play a much bigger role in pandemic management. And I think today what is very obvious is that you also have digital technologies which are also helping us to manage and understand the pandemic much more. I mean, in India itself, we found that certain states managed the pandemic better than other states. And, if I were to give you my view of why did Bangalore do a better job than many of the other big metros, like Delhi and Mumbai and Chennai, I would say it was because during the lockdown, I think the testing protocols that we used and the contact testing protocols that we used were at a much higher scale than any other city. So for every one person who tested positive, we were able to contact trace a minimum of 45, which I think was the highest. And that is what I think we did very well during the lockdown. I mean, now, as you lift the lockdown, you can't help but the virus to spread, because, the infection rate is going to go up. You cannot prevent what we call as community spread in a country like India. I mean, we just have too many people. Even in Bangalore, you're beginning to see numbers increase. You're beginning to see the low numbers that we had during the first 3 phases of lockdown. The moment the lockdown lifts, you are going to see much higher levels of infection. So I again go back to my point that you've got to keep the mortality rates low. And that's again going to require very good management. People are presenting themselves to the hospitals very late. They need to present themselves very early so that you can treat them and, manage them much better. So the outcomes are going to be much better if you come earlier on to the hospitals. Having said that, I think when it comes to lifestyle changes, yes, we have to make do with some lifestyle changes until we are really safe with a vaccine. So you are going to have to wear mask and protective clothing and, sort of maintain some physical distancing. You can't go about business as usual or life as usual. In all our workplaces, we are actually practicing physical distancing, zoning, and many other protective methodologies. So I don't think we should even think that we can go back to the old norm very fast, because I really believe that, yes, we need to feel in a safe place before we can actually start hugging each other and going back and frequenting restaurants and bars like the way we used to. So yeah. I'm afraid you will have to manage with this at least for the next 9 to 12 months.
Right. And I think, re-emerging is going to be as challenging as the lockdowns and as dealing with the pandemic really have been. I know Samir Saran is with us, the ORF's president, who's here to make a few comments as well. But before I hand over to him, Nirupama Rao, one last question for you, which is that, when Kiran talks about the need to wear masks and maintain distance, physical distance. I don't like the term social distancing because that's sort of an alienating term, but, physical distancing and things like that. We are seeing time and time again that our leaderships across the world, leaders that we sort of vote into power or seek to emulate, if they don't lead by example when it comes to this, when you see a Donald Trump face the press without a mask and his medical team right behind him wearing masks, or our own government ministers and officers wearing masks like it's a neck scarf, for example, what is the kind of lesson that it sends out to the rest of the world? That's one. And the second, which is possibly a corollary to this, which is, there are lots of stories that have been done about the fact that countries with women leaders have generally done better in the last few months. So, I mean, some lessons over there for everyone.
Yes, I'll take your second question first, Maya. As far as the success that we've seen in dealing with the pandemic in countries whose governments have been headed by women, I think the results are there for all to see, and I think you can draw the right conclusions from them. And I think we need to give much more of a chance to women leaders, not only in terms of situations like this, but in dealing with problems that concern, the future of the world. So that's the answer to your second question. And as far as the first,
including our Kerala health minister.
That's
yes,
right.
absolutely,
That's
Shailaja teacher. In fact, in fact, we should recommend her for the Nobel Prize, I think, in my view. So, and all perhaps a Nobel Prize for all the women leaders who've done so well in this situation. But the point about taking the disease seriously, I think that's extremely important. It doesn't respect barriers of wealth or privilege or underprivileged. It affects all of us. It is an anthropological threat, as President Macron called it. So it devolves on our leaders, and I think it's their responsibility to take this threat seriously and to be an example, to kind of be an example through the protocols that they observe to the community at large, to the population at large. Thank you.
Right. And I think, Samir, with that, I'm going to hand it to you as well, because in fact, the words that Ambassador Rao just used, that President Macron used, actually, the anthropological threat, the idea of putting these essays together was to paint what we called an anthropological canvas, because COVID is going to change our lives for the long term. I mean, we've been through pandemics in the past, and the world has learned different lessons. Some will argue that, some things remain the same. So, while we are dealing with a pandemic that knows no division and knows no barrier, we're seeing the creation or the re-emergence of barriers as well. And I think those are important things for us to remember in the research community as well as we go forward, because as we spend our time working on ways to collaborate, communicate, cooperate, and break down barriers, I think we're being confronted with new challenges ourselves.
Maya, thank you for letting me come in at this stage. But my sole purpose of speaking today is to thank you, Shoba and Laetitia, for working from home, from being logged in and still reaching around the world to put together important set of essays that are chronicling a very important moment in human progress. You remember when we had this conversation, a role of a research institution and a think tank is both to respond to the immediate, but also to put together research that is going to outlive the moment and that will allow future generations to look back and understand how we responded as societies, as countries, as communities, as international institutions, as economic systems, as people. And I think what you've done here is something that we are all aware of deeply. We are living the moment. We are deeply familiar with many of the essays that have been put together. But for future generations, these will certainly be reference material as they write their essays and look back at how India or communities or countries either failed, struggled, or succeeded in responding to a challenge. So I think there is a historical significance to the work you're doing. And like Ambassador Rao mentioned, I think it is but fitting that three of our brightest scholars, led by Maya, has put this collection together. And this is the first of the series of these essays that we are putting into place at ORF. The second one is focusing on some of the more economic aspects of responses. And the third one is looking at some of the geo-economic responses, the geopolitical consequences of the pandemic. And we hope that over the next 3 months, as we respond to a pandemic whose wake is going to be at least 18 months as Madam Shaw mentioned, if not longer in terms of consequences. We contribute to the global repository of thinking. So thank you, Maya, thank you, Laetitia, and thank you, Shoba, for taking leadership. And I'm sure this essay is blessed by the fact that this is again a women-led project. You know, you're not allowed the rather boring old frameworks of putting together conversations to come in your way. And I hope this begins conversations and debates and discussions in the future. Let me thank the panelists who've come and shared and spared their time and joined us in launching this report. And of course, each of the contributors who have contributed articles. And we hope that this process of building a collective experience library is something that we can contribute to. So thank you, Maya, for allowing me these 2 minutes.
No, not at all, Samir. Thanks so much for that vote of confidence. I mean, I think Shoba and Laetitia have really done a lot of heavy lifting. I'm just taking the credit along with them, but thank you all. But as we said that between Nirupama, Keshav, Kiran, Shaw, we've all talked about essentially a couple of things. One is that we need to figure out solutions. We need to ensure that the solutions are driven by both a sense of empathy and a sense of creating an atmosphere of confidence. Whether that confidence is about our economic situation, our physical health situation, or our social environment and our social interaction. I think there's a lot to be learned from this time. I hope we all survive it. We stay safe and sane. And with that, I'm going to hand over to Laetitia, who's our third editor of this volume as well, for a vote of thanks. Thank you all very much for being part of this great panel.
Thank you.
Hi, hello. I'm Laetitia, one of the co-authors of the GP series, as Maya has mentioned, along with Shoba. It's been an engaging 1-hour discussion on this pandemic, which has truly been the center of our lives for the past few months. Samir has already done this, but I'd like to thank our esteemed panelists, Ambassador Rao, Ms. Shaw, and Mr. Desiraju for taking the time out of their busy schedules to join us this evening. Of course, a big and resounding thank you to the people without whose work today would not have been possible at all. So thank you to all the authors of the series. There are 26 authors from over 10 countries. So thank you for bearing with us, for all the back and forth that we had been doing and across time zones. And special thanks to Preeti, our colleague from the publications team, who coordinated all our efforts and copy edited the series. And of course, last but not the least, we thank our partners at the Global Policy Journal, at Durham University, and Wiley-Blackwell for being our partners in the GP-ORF series of publications. And thank you all for attending our launch and panel discussion. Have a good evening.
Thank you all so much.
Thank you.
Thank you. Thank you so much.